Good evening. Good evening. It is Wednesday, February the 23rd, 2022. I am excited for this conversation like I am with all my guests. Again, we are live on YouTube. If you have not subscribed, please do so. It is the name of the show. Like and share. We are live on my Facebook page, which I will make public so people can get on. Again, please invite someone to the show. Again, I am excited. We are live on Spotify as well, and Twitch and Twitter. So, again, thank you so much for coming in. Again, I believe in 6 degrees of separation. You are one person away, one advice away, one help away from where you need to be in your destiny. It has been proven over and over again. And I am so excited. Let me go to this Facebook page to make it open. And we're going to get into this wonderful guest tonight. I have been waiting for this because I have a whole bunch of questions. So this wonderful lady right here is Dr. Kerry Ann. Is it Gordon or Perkins? Both. Or is it both?
It's both.
So I'm going to tell you, before I get into her bio, I saw her on Instagram and I want to say TikTok. She's the doctor that's dancing, doing all of this stuff to her music and telling us about our bodies. Okay. And so I'm looking, I'm like, okay, wait, let me read this again. What is she talking about? Oh, I need her. And some of the stuff that we've been taught as women over since growing up has definitely been in error. Okay. So I said, I'm going to reach out and see if she will come on the show. And look at this. Here she is. So it says, hello, my name is Kerry Ann Perkins-Gordon. I am a board certified and dynamic obstetrician and gynecologist practicing in the state of New Jersey. I have extensive expertise in global maternal health needs, problems of the female reproductive tract, contraceptive care, and minimal invasive surgery. I also have a burning passion and commitment to fitness and a holistic approach to a healthy mind, body, and spirit. I am a native of the beautiful island of Jamaica. I received my Bachelor of Science in kinesiology, right? Exercise and sports science from Temple University. I have a Master of Science degree in biomedical science from the Philadelphia College of what is this?
Osteopathic.
There you go, medicine. And it is executive master in business administration from St. Joseph University. I received my medical degree from PCOM and completed my internship and residency in obstetrics and gynecology at St. John's. What is this?
Episcopal.
Yeah, hospital in Queens, New York. In addition to medical practice, I am a captain in the United States Army Reserve. I'm an innovative scientific researcher with over 16 research publications and abstracts, and notable honors and awards for innovative contributions to the research community. When I'm not at work, I enjoy traveling, exercising, social media, which is her handle at Call Me Dr. P, and spending time with my husband and family. I also enjoy medical missions, serving in clinics and hospitals around the world. My most recent missions include Ghana, Africa, and Jamaica. Honey, honey, honey. Welcome, Dr. Ann Gordon, to the show, you guys.
Thank you so much for having me, Camila. It's a pleasure.
And she said my name right too, y'all. Oh my God. I'm so excited. Oh my God. So again, I'm telling everyone that I met you through my phone.
Okay.
On TikTok as well as IG. And you were doing I guess some Jamaican music and you were moving and dancing. And every bullet was about breaking down the smells of your vagina. We gonna get real, people. Things to look out for as far as odors, discharge, the things that we should be eating. Recently I think it was one about berries and things of that nature to make sure that everything is on point. So let's get into this conversation.
Okay, let's do it.
So you have extensive work in, of course, the female body.
Yes.
And so, with that being said, I know as young adults, we were told, especially when it was time for our menstrual cycle, the things that we should do. Meaning like dushing, all of these different things. Can you break down what's the truth and what's not the truth? Please help us out.
Yeah, you know what? You're very, very right when you say that this is how we were taught. And you know, a lot of things when I come out with them, people are just like, that's like taboo. Okay, we don't do that. No, but what about this? What about that? And because it's not our fault that we learn things the way we did. Okay. As people, you know, as we become more knowledgeable, it's our duties to kind of make a change so that we can make sure that our bodies or temples are as healthy and in the best level of health as possible. Right. And so it's, you know, underwear, that's one of the big ones. You know, what do we need them for? We don't need to wear underwear on a regular basis. We don't need underwear.
Wait, time out. Wait.
Like underwear. Why? Like why? We need.
So we're not wearing underwear every day?
What are we wearing it for? The only maybe two reasons that I would say that underwear can be helpful. One, when you're on your menstrual cycles, right? So you're wearing pads, which is another story altogether, right? We're putting chemical-filled pads against our most intimate areas that are absorbing all the toxins, all the chemicals, all the fragrances right next to our most intimate parts, okay? And so if we're going to take care of our eyes or our mouth very carefully, our vaginas are no different. So we're putting all these chemicals against our most intimate areas every single day. And then we're kind of concerned when we have all these pelvic issues, pelvic pain, fibroids, you know, endometriosis. We're having all these issues, vaginal discharge, vaginal odor, not understanding that we are forcing our vaginas to deal with these chemicals on a regular basis. And so we don't need them. We don't need them. We need to air out, let it breathe. We need air to pass through as easy as possible. So when you have a lot of clothing and things against your vagina, you're not allowing air to pass through. It's not in a very happy state. So yeah, so underwear is one of the big ones, you know, and you know, you grew up, you always as a child, a little young girl, you're gonna put on your underwear, okay? You can put on nothing else, you're gonna put on your underwear. Right? Once you get to puberty, you're going to wear a brassiere at the same time, right? But in truth be told, our bodies are happier the more free they are without being all tightened up. You know, people wear the wrong size brassieres and you can cause breast damage. You can cause injury and trauma to your breast tissue. Same thing with the vagina. We want to be free. And so, you know, a part of my goal as a physician is to be able to kind of change the taboo and turn it into normalcy, okay? So that we can get to a place where our bodies are happier.
Wow. Now, underwear, I was not ready for that answer. I know about the okay breakdown, like say for instance when it's time for the month and the tampons versus the pads, all of those different things.
Yeah, well, you know, it's really in general to each his own. So let's start that. So, you know, there's no need to feel guilty for using any one thing. Okay. Some people prefer for the pad to be on the outside to collect all the menstrual blood that is being released. Completely okay. My recommendation to that person is that you want to use one that is as free of chemicals and fragrances and use it only when you need it. Okay, so if you're on like a very light period day, use a liner. And then once you're done, nothing, absolutely nothing. Okay, if you are a tampon user, the same thing. You want to watch your flow. You want to make sure you're using them well. On a heavier day, wear a super or a heavy. On a light day, you wear a light. When you don't need it, you want to go ahead and you use a liner. And so as soon as your cycle is done, you're done as well. Nothing else in the vagina. If you are thinking about trying to be a little bit more careful, okay, and meaning that you want to offer less chemicals and exposures to your body, then the menstrual cup or the menstrual disc might be a good option for you for a couple of reasons. One, it will save you a lot of money, okay, and so in one of my reels, I talk about the fact that when you add up all the amount of monies over your lifetime of having 450 periods in your lifetime on average, right? And the amount of money you're adding to the industry when it comes to female healthcare, it's a lot per person. You're talking about thousands and thousands and thousands of dollars. So if you want to go into a cost consciousness, then a good option is to go with like a menstrual cup where you're inserting it and you're able to reuse the same cup. And you can use something to collect your menstrual cycle blood without being able to, having to change every few minutes or every few hours. You can actually wear them for a longer period of time. And so you save money in the end. Okay. So regardless of the products you're using, you just want to go in the direction of using less chemicals. Okay. Less chemical exposure so that your body is not absorbing all this extra stuff that internally can hurt your body and hurt your system.
Okay. Now we have talked about this with girlfriends.
Okay.
When it comes to actually washing our
Uh-huh.
vagina,
Yeah.
please break that one. And I know I said all real about that one too. So please break that one down.
Yeah. And it's super, super simple. And I say simple because sometimes we make it too complicated. We're constantly searching and Googling and saying, okay, well, what about this? What about that? This one can do this and this one can do that. And so we're constantly trying something else because we're living in a society where it's like, we always want to make it better. And oftentimes we think that more is better, but it's not, and so before we dive into that closer, let me tell you, most people don't understand the anatomy. Okay. So the vagina is where the entrance, this is where like sexual activity would begin and goes all the way up to the cervix, which is like essentially it's like a sock, right? And so there's an entrance and it goes all the way to a cervix, right? That's a length. That's a specific length that's very unique to every person. That's the vagina. The outer areas that you can look at is not the vagina. If you can take a mirror and you can see without touching your genitals, you're not looking at the vagina. You're looking at the lips, the labia, the vulva. So when we say that the vagina is a self-cleaning oven, right? We're not talking about the areas that you can see, the areas that you can look at. We're talking about when you separate your labia and you enter into that space that's called the vagina. Okay, so vaginas, you don't wash vaginas. You don't douche. You don't steam. You don't use yoni pearls. You don't use anything in the vaginal space because when you're having that discharge on a regular basis, that's your vagina cleaning itself. And that's normal. It's happening on a daily basis. You let your body do what it needs to do on its own. That's where the vaginal flora is. So if you hear pH and, you're getting bacterial vaginosis or yeast infections and all of these things, you're affecting that vaginal space. Now, when you're taking a shower on a regular basis, the only thing you need is water. That is it. You don't need anything else. You need water. You don't need a soap. You don't need a wash rag. You don't need nothing. You need water, your hands, okay? Because it's very sensitive skin. And when we do too much, we encourage your body to get off balance. And once we get off balance, our pH is becoming more basic and not as acidic as the vagina likes to be. Once we do those things, we are now causing the bacteria to be imbalanced and causing an infection. And so if you have recurrent infections, you've got to pause for a second And I tell my patients all the time, just stop and write down, examine your entire life and see what it is that you're doing that could be causing your pH to be thrown off. Okay. And chemicals, pads, washing, detergents, the soaps we're using are all a big part of this. It's huge. And so you want less is more. But if you do choose to wear a wash with anything else other than water alone, then you want to do a couple of things. The first thing is that you want to avoid hard soaps. Okay. So the option number one and the best option would be to go for something that's a liquid soap. And the reason is for chemicals to be formulated together into a hard bar, a bar that kind of goes away little by little with more and more use, right? That doesn't, squish in your hands. Chemicals that are not healthy for your body are used to make that formation. Okay. So stay away from the bars. Stay away from things that are full of fragrances. We love a good smell. And coming from a Jamaican family, that's all we knew. Okay, your lotion, your soaps, sprays, you want to smell like amazing. Okay, all those chemicals, they're all toxic. In medicine, we have a term called carcinogenic. Okay, that means it is cancer forming. Okay, agents that encourage cancer to be formed in your body. All these fragrances have carcinogens, which are cancer forming agents. If anyone listening would take a bottle of like their perfumes or anything and actually go and research all the ingredients that are listed there, because it's listed there, okay? It's not hidden. And you research that and see how many cancers that's linked with. And then it will cause you to pause for a second and think and say, okay, what exactly am I putting on my body? What exactly am I washing my most intimate areas with? What am I, so happy with the smell, but internally I'm killing my system. Okay. Wow. So it's rough. It's rough. But the good thing about it is, again, once you learn, we do a little bit better. Right. And so you don't want to wash your most intimate areas with too much. Fragrance-free, unscented. You want to look for words like parabens and sulfates. You want to avoid them, okay? So that you know that whatever options you're going for is one of the best options there that exists, okay? Just in case for those who don't, feel comfortable with just the water.
Okay. What about I know a lot of women who, when they take their bath, they're doing like a cap of vinegar or bleach. Some people done that. So is that good or no?
So you're taking caution, like, wait, I just don't really know anymore. Okay, there is some evidence that shows that if you were to have like certain types of chemical imbalances, that there is some chance that when you're in this bath water, that it could cause some of the water can go inside and kind of help with rebalancing the acidic nature of the vagina. My caution to that is that one, you want to talk to your provider about it first. Okay. So you want to have a reason to. You don't want to just like, I just want my vagina to smell good. Let me do this bath because I heard about it, because everything comes with risks, right? Everything comes with risks. So when you're in this bathtub, there's germs and there's things in the water, there's things on the walls. And so the more baths you're taking, regardless of what type of baths, guess what you're introducing to your most intimate areas. Okay. So you want to talk to your provider about it to see if there's going to be any specific benefits for you individually, because we're all different people. And so we want to celebrate the fact that your body is different from my body, and neither one of our bodies have ever been studied before. We're unique people. And so because of that, you do want to talk to your provider and say, okay, this is what I look like. This is what my history is. This is how things tend to be with me. Would this be beneficial? Okay.
That's good.
Yeah, but definitely don't do them on a regular basis just because, okay? Because sometimes we do way more harm than we do good.
Okay. So what is and I know I saw a reel about some things that we should eat to help with our bodies. And I believe it has something to do with berries. I'm not
okay. Okay. Yeah, so there are definitely lots of stuff that we should. Ooh, water. Yes, water. I'm gonna tell you that that's probably the number one thing on the list. Okay,
Okay.
you want to drink a lot of water. Okay, but definitely the things that we're eating are, I tell my patients this is what I say starting these conversations, that our vaginas are our outward way of giving us communicating with what's happening internally. So our bodies are outwardly, from what you can see, smell, and touch, giving us an idea of what's happening on the inside. Okay. The foods we eat on the inside are affecting us down there. Okay. So whether it's a good to help with the good bacteria and balancing out everything, or the bad that is disrupting everything. Okay. So we can talk about a little bit of both of them, right? So things to avoid, there's so many research. This is like evidence-based medicine I'm referring to, that says that sugar causes imbalances of the vaginal flora. And that sugar could be in the format of the sugar you put in your coffee, the sugar you put in your tea. It's the juices you're drinking. It is the sodas you're having. It is the rice and the bread and the potato and the pasta. It's the, sweets that we have, but it's also the fruits. It is also the fruits that we're having. If we're indulging in a lot of the sugars from the mangoes and the apples and the kiwis and the pineapples and all that good stuff. Okay, and I'm Jamaican. I know about all these things. Okay, I used to have like bowls and bowls of these types of fruits every day, thinking that I was doing my body really, really well. Like I'm just healthy fruits and vegetables. I've got it done. But let me tell you, I used to suffer from vaginal infections regularly. And I just couldn't understand, because you would finish your antibiotics and then you're just like, I just had an infection like last month. Like I haven't done anything any differently, checking off all these boxes. But it wasn't until I understood how your diet is linked very closely to what's happening in the vagina, that I cleared. I don't even get medications or need medications or have infections anymore. And it's been almost 10 years. Nada. So going from multiple times a year to nothing. Okay. And that diet was everything having to do with that. So I had to cut back on those vegetables and those fruits that would be very starchy and have too much sugar, carbohydrates with them, and start eating the ones that are a little bit more on the healthier side. So eating a lot of orange things, so orange, like a sweet potato option without all the sugar and the maple syrup and the honey and all the jazz, right, is a better option than the white rice, the white potatoes, and the pastas and the bread, right? So more orange, the bell peppers, having things that are more high in antioxidants, things that have a lot of vitamin E, vitamin A, you want vitamin D, like all of these, the B complexes, because they all help with the vaginal flora, the vaginal discharge, and balancing things on a regular basis. It's the avocados, it's healthy fats. It's a lot. It's like, it's when you encourage your body to function better, your body will stay on your side and will help you out.
That was good, because I know one of the ways I know that my sugar is off
Mm-hmm.
is I get yeast infection.
Yeah.
And she said, well, that's the way that your body is telling you that your sugar is definitely off. You need to check and all of this. And of course, we know as women, yeast infections are not fun at
Mm-mm.
all.
Mm-mm.
And so, you really start, and that was another reason why I was paying attention to you, because at the time I did have a yeast infection, and I
Mm-hmm.
wanted to know what was causing it, for one, and the things
Mm-hmm.
that I could do um without having much of a medicine um
Yeah.
doing it. And
Yeah.
I'm like, she is on point. She don't even realize that she's helping me by the things that we're talking about.
Mm-hmm.
Now, the other big subject that I'm going to get into, of course, is sex. And so I saw a reel about what the do's and don'ts after you have sex, or like, oh, so please tell those people
Uh-huh.
about the what to do while you're having sex, before you have sex, and after you have sex.
Okay. Good stuff. Yeah, sex is one of those things that I encourage that females enjoy sex as much as males. I'm all for it, and everything that we need to do to make sure that our pleasure is at the highest. Okay, to encourage orgasms, to encourage self pleasure, to be able to talk about the things that are not necessarily feeling as great. We want to have those conversations because our pleasure is our pleasure and just as important as anyone else's. So anything having to do with that, I'm like, I get all really giddy, like, yes, let's do it. Let's make it happen. Because I want you to be happy in your happiest moments, right?
Right.
So we don't want you to leave but disappointed. We want you to be happy too. Okay. So things to do, okay, in general, outside of regular hygiene, some people will take too many showers. That is a thing. Don't take too many showers now. Okay. I had a patient on Monday this week, and she told me, she's just like, yeah, my husband says I shower too much. And I'm like, what do you mean? And she's just like, yeah, she essentially takes like a mini shower right after every bathroom use. Don't do that. Like every bathroom use, she's taking a minute. I'm urinating or defecating. She's taking like a mini shower. And that's just too much. So don't do too much, because the more that we wash and get a little bit too much scrubbing of our skin, is that we open up the pores of our skin, right? And then we can encourage infections and abrasions and irritations and swellings and inflammation happening there. So don't do it too much. So that's number one. Number two is obviously to make sure that your partner or partners are also of good hygiene as well. Okay. So, if you don't want to practice sexual intercourse without being clean, that's in general. Okay. Now, before sexual activity for females, we need foreplay. Foreplay, foreplay, foreplay. If you think you had enough foreplay, get some more foreplay in. Okay. Why? Because we are like slow cookers. We need time to get the process going and to get the food bubbling and for it to be ready. Okay. We're not like microwaves that you just go ahead and put in 3 minutes and 2 seconds and then we're ready. We're not like that. And so your best sexual, exploration and enjoyment is going to come with you being stimulated throughout the day with words and encouragement and touches and kisses before you get there. If you have enough sufficient lubrication, the sexual pleasure will happen a lot better, a lot easier, and you will really touch and become in touch and in tune with your inner self. Okay, so lots of foreplay. Okay, don't rush into sexual activity, because if you do that, it's going to cause pain. It's going to irritate your vaginal walls. And again, once you irritate those vaginal walls, then you're now prone to getting infections. Okay. And those infections could be STDs. It could be from bacterial vaginosis, yeast infections. It could be just irritation in the area. So don't rush into sexual activity. Okay. Enjoy sexual activity to your desire, your positions that you're happy with. If you're not a doggy style girl, that's okay. That's all right. You communicate with your partner so that sex is pleasurable for you. I had another patient on this past week that has fibroids, huge fibroids. And she started a new sexual relationship in the last couple of weeks, and she just started having so much pain. And she's just like, I just don't know what's happening down there. And during her exam, I'm just like, because you're almost having sexual activity with this fibroid. And that's why it's painful. It is painful down there. So you want to know your body, see your GYN, know what your medical issues are, so that you can work around them and find a position sexually that's going to work for you. Now, as far as the regular GYN stuff and the post-sexual activity plannings, go to the bathroom right after sex. You don't want semen, if you're having sex with a male, to sit in the vagina or in the vaginal space for a long time. And by a long time, meaning for more than a few minutes, for a couple of reasons. The first thing is that semen will cause your vagina to be less acidic. What do I mean by that? If this is a vagina here, the vagina likes to be on this side, loves acid, loves it. That's what we like. Semen is over here on a pH scale where it loves being basic. That means a higher pH. When the two of them meet together, they meet in the middle. The vagina does not like being in the middle. Vagina is like, hey, I'm happy over here, okay? But semen automatically brings the vagina out of its normal space to one that it's not used to. This is where infections happen, right here, okay? So if you have the semen meeting with the vagina and it stays there for an extended period of time, now your vagina is now thrown off and now it's imbalanced. Now this is when you get those infections. So after sexual activity, you want to go to the bathroom. And so what I encourage people to do is to almost do like Kegel exercises where you're kind of like squeezing to kind of make sure that there's no extra semen hanging around, okay? And then you also want to urinate. And the reason why is because during the action of sexual activity, bacteria will move from the rectal space, meaning your bottom, to the vaginal space, to the top opening, which is called the urethra. And in that area, that bacteria will go into that space and go to your bladder and cause an infection. So when you pee, what you're actually doing is you're washing that bacteria out of that space. So peeing is important. It's your body's way of washing away bacteria so that it does not stay and go into the bladder, causing an infection. So you pee and you do your little Kegels after your sexual activity so that you get all that extra semen, get that bacteria away, wipe from the front to back, and then you should be great.
Okay, so for those who are on right now, if you have any questions, please put them in the chat so we can actually ask her the questions while she's here and get some of this things out of the way that um we have in error learned. And so we want to get this information out so we'll all be on the same page when it comes to our vaginas. Making sure that everything is um working properly.
Mm-hmm.
Um is there any other ways for those who are having fertility issues? Like say for instance, if they are diagnosed with PCOS or irregular cycles that they can't figure out when they're ovulating like most people.
Mm-hmm.
What do you do for those people?
Yeah. The first thing is to depends on your age. You know, if you're someone with PCOS at the age of 20, you have a little bit of time on your hands versus somebody who is, you know, PCOS at the 35 or 40. And so depending on where your age is, the goal is to try to control and manage the PCOS or whatever that underlying problem is as best as possible. So if you don't have much time, you know, sometimes our next best bet to be able to use the eggs that you naturally were born with might be to go on medication, right? So we have medication that is specific for those with PCOS to help with the ovulation process, to help releasing that eggs from month to month, because someone with PCOS isn't necessarily releasing that egg. So if you can imagine, you have all these eggs that are maturing and getting ready to ovulate within the ovary, but because of the PCOS condition, it's not coming out. So they're there, they're ready, they're not popping out. So we have medications specifically that will help with this type of patient to help those eggs actually ovulate out of the ovary. Okay, so that's if we're running out of time. This is when, you know, you've been trying for years and you've not been able to achieve pregnancy, and we've already ruled out problems with the uterus, the ovaries, the fallopian tubes, his semen, okay, which we tend to forget that his semen could be a problem too, right? And so if all of these things have been ruled out, then we can go with the medication. Now, if we have time and we're just like, okay, I do have PCOS, I'm not necessarily trying to get pregnant at this moment, but I understand that I might have a difficult time. You want to get to a place where your body can be ovulating on its own, without any assistance as best as possible. Now, PCOS, for instance, a big issue with PCOS is that there could be a lot of insulin resistance. you can have issues where there's too much male hormones like testosterone in your system. Okay. And so these people might have like hair on the chin and on like their chest and their upper thighs, that's one sign of that happening, right? Sometimes it could be getting bald, having a lot of hair loss in places. Those are small, subtle signs. Others, though, can also incorporate being overweight, having difficulty losing weight. Okay. It could also have not ovulating on a regular basis, which means instead of you having 12 cycles for the year, you're really having 5 or 6, if that. There's some people that can go 6 months without having a period. So one of the key ways for those kind of patients is diet. I scream diet all of the time. And everybody's dietary plan is not the same as the next person's. So we can't anticipate that what I need to do for my body, you will need to do for your body. Or 2 PCOS patients might have 2 completely different needs to help their bodies be optimal. So you want to optimize, you want to change your diet, you want to reduce the amount of excessive hormones that are being produced in your body. And that a lot of times can be linked with fat cells. Fat cells create extra hormones. Fat cells create extra hormones. They create their own hormones. And sometimes fat cells can cause such an increase in the hormones that it shuts your own hormones down. And that is a major problem in a lot of patients with PCOS. Not all of them, but a lot of them. So working with your physician or with your provider means trying to optimize and reduce all those extra hormones so that your body can start doing its own work and function on its own. And it's completely possible. And it's, yes, you can get pregnant. I can tell you so many patients tell me that I have PCOS, I was told I can't get pregnant. That is not true, honey. That is not true. We just have to optimize your body to be able to ovulate on your own or assisted with medications so that it can happen.
I appreciate it. I have 2 questions.
Sure.
One, what are some natural ways to clear up bacterial vaginitis?
Okay, so bacterial vaginosis, okay, is where there's that imbalance with the bacteria, okay? Now, the best way, proven by far effective-wise, is to get antibiotics. Outside of that, the ways that you can naturally do this, one of the best ways that you can try is with boric acid. Okay. And we say natural in the sense that you will use something that is not a prescribed medicine that is often very effective in trying to reverse and rebalance the bacteria in your vagina. So boric acid is one of them. Okay. Other options are being sure that you are dietarily eating well. Now, I say that with a little disclaimer because whenever there's already an increase in bacteria there, it's almost too late to do these things. What you want to do, and this is what I recommend, clear up the infection first, get the antibiotics or the boric acid, work it out, get to a good place. Then now to stop recurrent infections, meaning if you are used to getting these infections 3 or 4 times a year, once you clear and your body gets to a balance, now you need to encourage that your body stays in this zone of being balanced. And the way that you want to do that is with your diet, exercise, and with drinking adequate amount of water.
Okay. What about I was told or I read that they do like a suppository of yogurt.
Mm-hmm.
Okay.
It's a thing. So if we were to go deep into some of those, kind of suppositories that you can use, listen, yogurt is good bacteria. Every single time we sit and we're eating yogurt, we're eating good bacteria. We are eating cultures. And so what happens is that it's not every kind of yogurt works. Okay. So I had a reel that I kind of went into the details of how you can go about using these things. Yogurt, for instance, you want a plain, non-fat Greek yogurt. It should not have any additional flavors. It shouldn't have vanilla. It shouldn't have any of that stuff that we talk about. None of that. Just the plain yogurt. What you can do is that you can take a tampon, okay, and you can soak it with the yogurt. Some people will even put it in the freezer so that it kind of holds it together. And then you slide it on the inside and you let it stay there for a few hours and you take it out. So essentially what you're doing is that you're introducing the good bacteria in the space that bacteria normally lives and encourages the good bacteria to grow. Okay. Those really work a lot better when you're not having a massive infection at the same time. And it's really good to help to maintain. But that works. There's other things that you can do where you can use like tea tree oil. You just have to be very careful because sometimes you can burn yourself. So you want to dilute it. And I have formulas with this so you can know exactly the amount that you're going to put, and you put it in another base and what that base can look like. You can have options like almond oil. You can use things like coconut oil as a base, and you mix them together, dilute them, soak your tampon in it, insert it vaginally, keep it there for a couple of hours. Okay. You can use garlic. There's like lots of different things that can be done, but with those, you want to be very mindful, talk to your provider about it, because you don't want to forget things in there either. Okay. So you want to be very mindful. You want to write things down, know what time you started, know what time you're taking them out, and talk to your provider about exactly how to go about those.
The next question is it a bad thing to put is it a bad thing to put baking powder and apple cider vinegar in your bath water once a week?
So that's what we were talking about a little bit earlier. So it's not necessarily that it's a bad thing. You're always weighing the risk and the benefits, right? So once a week is not necessary. Unless you have a problem that you're trying to solve, which you should talk to your provider about, you don't need to do this on a regular basis, because what it's not going to add to your vaginal space. If your vaginal space is happy and content, we don't need to do anything to it. We just let it be. The problem is when we do have a problem and we're trying to fix it. So you do want to first talk to your provider, see what the problem is, because sometimes we might think we have a yeast problem, but it's really bacterial vaginosis. Sometimes we think it's bacterial vaginosis, but it's really trichomoniasis, okay? Or it could be gonorrhea or chlamydia, because they can all present themselves very similarly, right? So you want to know exactly what the problem is, and don't stay away too long, especially if you think you've been having like a new partner, or your partner could be having other partners and like not a monogamous relationship. Whatever it is, you want to talk to your provider and check first. If this is something that's recurrent all the time, instead of always trying to treat the problem, we need to try to prevent the problem. So what is it that you're doing that could be causing you to yourself, your body, to always have an infection, right? It's always easy to try to treat. We want to treat, but we really should try to prevent it from happening so we never get the infection in the first place. And so that takes some investigation, okay? Are you having unprotected sexual activity, semen stain in the vagina all the time? What types of detergent are you using? What types of soaps are you using on the vulva? Are you using any other chemicals near the area? How's your diet? Are you taking your probiotics? Are you taking your vitamins? Are you drinking 2-3 liters of water per day? You know, there's lots of different things that goes into the formula of vaginal happiness, and treating it with these apple cider vinegar baths once a week is not necessarily the answer for that.
Um,
I can't hear you.
I had another question.
Okay.
I just
Okay.
lost it.
Okay.
Oh, so whenever the Lord decides to bless me with a child, right?
Okay.
I wanted to have a water birth.
Okay.
Are those good for your first time, or is it good at all? What are we doing?
That's a good question. Water births, I think, are beautiful. Okay. What I think is most important when it comes to delivery is not so much where, but your team. It is, who do you have involved with your care? Okay. And does the person who is caring for you, like, what is their scope of practice? How much can they handle? Are they able to handle high risk problems? Are they able to handle emergencies when they happen? Because they happen. And so you want to make sure that whether it's a water birth or a home birth or a hospital birth, that you have a team that is working with you and advocating for you. Okay, so you want to plan. So if you have a team that has a doula, a midwife, a physician, then you're well covered. Okay, because there's lots of beautiful things that doulas can do, right? But they're limited, they can't do everything. Okay, there's lots of beautiful things that midwives can do, but they can't do everything. There's lots of beautiful things that physicians can do, but they can't do everything, right? So when you have a combination that has multiple, then you know that you are covered for high risk issues, emergencies. If something were to happen to your baby, what will happen? Do you have someone to care for your baby and save your baby, support your baby? Same thing for you. You know, if you're hemorrhaging, is your midwife comfortable with dealing with that? How will you deal with it at home? How close are you to the hospital? So there's a lot that goes into that. So home births and water births are beautiful, but just have the right team available so that if something were to happen and an emergency is now happening, that they're able to handle it and save your life and save your baby's life as well.
And what are your thoughts on like having epidurals?
Okay. Epidurals, that's a good question. So there's lots of different ways that you can go about a painless or more pain tolerable birth. Okay. And so I am for anything that makes you comfortable. Okay. So whether you want to go by yourself and go without meds versus you want something, but you want it in the IV, so that it's not necessarily a nerve block, or an epidural, which is a nerve block. I can tell you that epidurals are great. Okay. But like everything else, epidurals comes with risks. Okay. There's a risk without any medicine, with IV medicine, or with an epidural. And so there's no need to suffer. I can tell you that there are patients that they would be suffering with the pain and feeling like they're about to die because of the intensity of the pain. And an epidural will just calm your body down in such a beautiful space that your labor is able to progress, that you're able to actually push effectively and you can get your baby out in a timely fashion versus if you didn't. And so it's not for everyone, but it should be an option for everyone. And I completely support it because an epidural can do a beautiful, it can change the whole scope of the delivery process a lot for a person.
Okay. I know in my spare time when I do have time, I do
Uh-huh.
watch a lot of videos of
Uh-huh.
women giving birth, both in the hospital, home births, as well as water births. And
Mhm.
I discussed this with my husband that I definitely would want a water birth just because of the serenity of it, um, the calmness, and just being different. Um,
Mhm.
the only thing is, I don't like pain, period. So a
Okay.
little headache irritates me. So I already know I don't like pain,
Okay.
which makes me wonder about the whole birthing part altogether. Like, okay.
Yeah. So it is a part of what you have to think about because again, it's not for everyone. And I tell patients, no one else is feeling your pain but you. I'm not feeling your pain. Your husband is not feeling the pain. Your mom's not feeling the pain. And it's okay for you to say, you know what, I want pain relief. Okay. You don't need to suffer. But that is something that you would want to think about. If you want to get a home birth or a water birth, you've got to say, hey, I'm going to commit to this. So it doesn't matter how bad those contractions get. It doesn't matter how bad the pain is, that I'm staying committed to not having anything for my pain relief. It can happen though. People do it all the time. And it's a beautiful thing.
I'm gonna call you and be like, I have a personal doctor. She needs to be on hand. We talked about this. Um, we have one more time for one more question.
Okay.
Anyone who has a question who's on live right now
Okay.
to ask this wonderful, beautiful doctor another question before we I tell you an hour goes past so fast when you're having fun, you're having education. Um I'm enjoying this. Like I said, we broke down a lot of myths And the one thing that I learned the most tonight is wear. Y'all don't understand. I don't like clothes as it is. So
Uh-huh.
to hear this, like, why are you wearing underwear? What? That just blew my mind. I'm waiting to see if we have one more question. If not, this has been an awesome conversation. I've had people just chiming in saying this is one of the best conversations that they've heard, and they like how you explained everything when it comes to depth in the conversation. So I appreciate you again. If you guys you can let them know how they can get in touch with you. Like I said, I found you on Instagram and TikTok, and it just blessed my soul every time I see you dancing and having a moment telling us something about our vaginas.
Yes, so you can always reach me at call me doctor dot like period P. And so that's both on TikTok and on Instagram. My website is going to be launched in a few weeks. So stay tuned because I have lots of good stuff coming on there. Lots of education, lots of information, and lots of ways to connect. And so you can always send me an email or a DM. The DMs have been a little bit slow because I get like hundreds of them. So don't keep me tied to that part, but the emails I do definitely respond to for sure, and comment on any of the videos as well. And I love an engagement. I love a conversation. So if you ever have like a topic or something specifically, just send me a little message and say, hey doc, can you do a video on this or talk about this. Even on our lives, my sisterly Sunday lives, said come on, join in, and we'll talk about anything that you want to talk about. Like I want us to get to a place where these taboo things are not so taboo anymore. Are you still there? Hi.
I don't know
Hey.
what happened.
I don't know either. It looks like you kind of froze for a second.
I don't know what happened.
Okay. Did you catch me or?
It was like freezing up. I'm not sure what it was. I think you were talking about your DMs,
Okay.
and then it froze.
Okay, got it. So yeah, so I was saying, you can always send a message if there's like something like a topic that you want to talk about that you haven't seen a video about, and we'll address it. You can join on my Sisterly Sundays, and so we can live in a live session talk about all these questions. As I was saying before, it's like the goal is to bring these taboo things into like a normal world and normal conversation, so that we don't have to keep things on the inside anymore. We can release it so that we can be free people living our best lives.
Absolutely. Like I said, I enjoyed this conversation. To From the cleansing to things that we should and should not do with entering our vaginas, our cleaning habits, things to do before and after sex. All of these things is a part of is natural. So again, it should not be a taboo conversation. Should be something normal. And then when we have daughters, when we have nieces, when we have all of these conversations, this should be something that is a normal conversation. Like I just got a call. My niece just had her first cycle
Aw,
yesterday. And
nice.
so, it was, her mom is not around like that. And so when she got it, her grandma was there. And so, she had to explain to her what was going on with her body. And
Yeah.
so I'm like, okay, I remember the first time that kind of freaked me out. I heard about it, but until it came, it was like, okay, what is this?
Here now. Yeah.
And yeah, so I understand that it can be overwhelming in the beginning,
Sure can.
but now it's welcome to womanhood.
Mm-hmm.
So
Womanhood,
again,
womanhood 101.
and so I was very happy, and like it would just put me in a different
Scary.
whole space. My other niece had just had hers, and so she has these moments of it's coming again. Like, girl, you just started, honey. That shouldn't even be a question.
Yeah, now you have 449 more to go.
So again, I'm appreciative of you taking the time out tonight to talk to us, to break down these myths. To again, I get something from every person that I have on here. So again, our time is up, but again, I will definitely reach out to you. And when that time comes, when I do get pregnant, I'm definitely hiring you, and you're coming to deliver my child. Okay. All is set
Sounds
in
like a
stone.
deal.
It's done. It's done. It's over with. So
Sounds
again,
good.
thank you so much. I
Welcome.
want you to enjoy the rest of your evening, and I will send
Too.
you this taping to your email.
Sounds great. Thanks. Thank you so much for having me. And much blessings and luck to your followers as well.
All right. Thank you. Have a good evening.
You too.
All
Bye
right.
bye.
Bye bye.